Okay, so welcome to the Plymouth Board of Health meeting on Wednesday, October 16th at 5 o'clock. Pursuant to Chapter 2 of the Acts of 2023, an act relative to extending certain COVID-19 measures adopted during the state of emergency signed into law on March 29th, 2023. This meeting will be conducted via remote means and in person, as long as members of the public can easily access the proceedings in real time and participate remotely. Until further notice, this meeting will no longer be broadcast, but it may be watched when the show is I guess it's recorded, so you have to go to YouTube to get the recording. Members of the public who wish to participate in the meeting may do so in the following manner. In person at the Rope Walk Meeting Room located on the second floor at Plymouth Town Hall, 26 Court Street, Plymouth. Note the occupancy limit of the room may reduce the number of attendees that can be accommodated. You can also participate remotely by using the link and the passcode that's on the agenda. So our first item of business, which is always quick, I hope, is approval of the minutes from our meeting on the 18th of September. I think, Deb, you weren't present for that,
I was not, correct.
so I'll just ask if anyone has corrections, additions, complaints. No. Meg, do you have anything to put in? You do not, okay. Neither do I. So I just need one of the members who was present at the meeting, preferably, to make a motion to approve the minutes.
I saw.
Dr. Reed makes the motion. Is there a second? I guess that means you, Meg.
Yes, I second that.
Okay. If there's no further discussion, I'll just call the roll of those who are present today. So Meg, yes or no?
Yes.
Dr. Reed?
Yes.
Myself, yes. So I think that's 3 members present, all approve. 2 members not present have excused absences. Next item is probably one of the more joyful things we do every year on the Board of Health. We're making a habit of this and we're not. So for a number of years, we've had high school students and last year intermediate and middle school students also join us as representatives from our high schools and middle and intermediate schools. We ask those who are coming to give us feedback about what you think is relevant to the health and welfare of the students that you know. You're going to see that there are some topics that come up that obviously do pertain directly to the students. So we will keep you informed of that. We know that you can't always come to the meetings because every student has so much going on in terms of extracurricular activities and sports and all kinds of stuff. So if there's a meeting, which are now only once a month, which you cannot attend, please just send me an email so we won't wonder what happened. So the one student we have already this year is Erin Hayes. She's from Plymouth South High School. And Erin, if you just tell the people that haven't yet met you in person.
Hi, my name's Erin. I am from Plymouth South High School and I'm currently a senior. I'm actually a member of the biomed program, and basically it's a program for 4 years throughout high school where we study medicine. Pretty much anything surrounding it, emergency medicine, forensic medicine, we learn about anatomy and biomedical innovations, interventions, all that stuff. Outside of school, I'm president of the Medical Careers Club. I'm also vice president of our music National Honor Society, and I'm a member of the National Honor Society as well.
No wonder the principal said you were another superstar. Well, thank you. Also, can you just give us a brief sort of feeling for what you think are the major medical issues or health issues
Yeah.
confronting the students?
I think the biggest issue that I've noticed just in school alone is the use of tobacco and nicotine, especially vaping. I think it's been an issue that's progressively getting worse. I know the school has tried to implement some different things in order to regulate it, like we have an online bathroom pass now, but it just seems to allow students to find other ways to go to the bathroom. and essentially vape and use pot, pot's a big one too. So I think that's definitely the biggest thing that kids are,
You know, we previously heard that they tried to put detectors into the bathrooms
yeah,
and it didn't work.
right,
Because by the time one of the, you know, school officials got down to the bathroom, the person who was using the vapes had left.
right,
And then the other people were in there and they got interrogated as to whether they were using vapes.
yeah,
So it's a difficult problem. There's no doubt about it. Flavored vapes seem to be the biggest problem. Is that
yes.
still the case as far as you know?
Yeah, I'd say flavored vapes are a big problem, and I think the smoking pot is a big problem too. I usually smell it off of kids. I know when I go to the bathroom, I'm very sensitive to the smell. So usually if I smell it, I'll get like an immediate headache and I'll have to leave, and I know I'm not the only one. So I definitely think something that's progressively getting worse too.
And have you noticed anybody using those little packets that they put under their tongues that are full of nicotine?
Not that I've seen, but a lot of the kids are really good at hiding at this point if they are doing it, so,
Yeah, some of the vape pens look like something that has nothing to do with vaping.
yeah.
But they do, you know, it's a difficult problem. So that's why I sent you the information that I pulled up off of the internet. It actually came from the Massachusetts Association, the Massachusetts Health Office Association. And there's a link there. And the reason I sent you was because I thought perhaps in your class. That link might be something that you might want to publicize, because there's there's apps that help people kick nicotine addiction. And so I was hoping that that would help.
Yeah.
Okay, so thanks a lot. We appreciate that and welcome. And next order of business is going to be a grease trap variance request from Sean Sinclair. That would be you. If you would mind coming up and sitting at the table,
Yeah.
because our old device has a vision problem, and then you need to be somewhere near the table.
I know, it's like, I can't put my nose.
So you can go ahead and tell us, why you need the grease trap variance.
Well, another reason, initial and most pressing ones, space readers are, I know some people come out to have a look at it, and we put the plans in. The readers do not have space there, we've got current grease trap, obviously, there's not the new one that's demanded. And we just had such a restricted space there, there's physically nowhere to put it. And then we don't try, we don't do that sort of thing. And then, tentatively, we try and wipe everything as well, and to ensure less grease goes into the dishwasher in order to have to be taken out of the dishwasher. Out of the grease trap.
And do you prepare anything that entails a lot of grease?
No, we just bake scones.
Just bake.
Make
There's
sandwiches.
nothing fried, nothing whittled, there's nothing, we don't have a griddle or fryer or those sort of things that produce most of the grease.
Okay. Anything else?
The department would recommend approval, but we also would recommend that you hire a professional company to clean out the grease trap. Right now, I think you're doing it yourself.
We do,
Yeah, we're gonna recommend and recommend that the board also put in the variance, if they grant the variance, that you have done by professional.
Okay, okay. Can you recommend anyone for that or?
Well, we can send you a list, yeah. yeah.
Okay.
Yeah.
The reason we're so wary of this is because, the town sewer system has had issues with grease blockages in that system.
Being aware,
They call it a fat bird.
Yeah.
I think it's happened in England also,
Yeah.
and it causes major problems and damage.
Yeah.
Yeah, I get that.
So we're looking out for that. to
But
make
even
sure-
England, we didn't even have to have a grease, you weren't aware of it,
Never
were
had
you?
grease
It's
trap,
okay, yeah.
yeah.
Yeah,
So maybe
yeah.
like McDonald's and stuff.
Yeah, big places must do, but small places,
Yeah.
no.
Okay. Dr. Reed, anything you would like to ask besides the recipe for the scones?
So I think
That's hysterical.
Yeah.
I know, you should have brought some hot tea.
It's getting that weather now, we're getting busy, haven't we? Yeah.
No, it sounds reasonable. I know the venue and it's not.
I've been there a couple of times.
Okay, yeah, but so it's literally a complimenting, obviously it gets grease, because we empty it and there is grease,
Yeah.
it's amazing how much grease you can get.
Yeah,
Yeah.
yeah.
It's quite,
Yeah, and by dry life, it eventually going in.
yeah,
into the dishwasher.
I've noticed that the scones, you put them in a paper bag, sometimes the grease sort of soaks through.
yeah, I don't really like
Fossil
But
free.
then they can change an awful lot of color.
Yeah. Yeah.
Okay. Anything else? Deb, do you have any questions?
Nope, I think they were answered. Thank you.
Meg, do you have anything?
No, I don't.
Okay. So if there's no further questions, I'll just ask a member of the board to make a motion. In this case, it would be a motion to approve under the condition that a professional company be hired to empty the grease traps, if I got that right.
You did, yep.
Okay.
We need to say within a certain time period.
No, we can follow up. Yeah, thank
Do you
you.
want it done at monthly then, or
Yes.
quarterly, monthly?
Yep.
So I submit with the stipulation.
Okay,
It's not a bad thing, because it's not a pleasant job anyway.
Deb or Meg, could you second the motion, please?
Yeah, I'll second that.
I think that was Meg.
Yeah. there was.
There's no further discussion. I'll just call a roll. So Dr. Reed, yes or no?
Yes.
Meg, yes or no?
Yes.
Deb, yes or no?
Yes.
Myself, yes. So it's unanimous of those present.
That's it.
Your request for variance is approved.
Excellent.
Okay,
Thank you very much.
wonderful.
Is this like a
With the
pending
condition.
thing now, or is this, that just it, there's no
No,
anything we have
it's-
to do, or?
It's for the foreseeable future until unless something
Yeah.
changes.
Yeah.
Yeah, but as the regulations are right now, you have a variance.
Okay.
If something should happen, you know, we have to change them for
Yeah.
whatever reason,
Yeah.
then you may have to do something else. But as of right now,
Yeah,
as the way things are,
it's just, yeah.
I'd rather get a company to do it.
Yeah.
Mhm.
Okay.
Good,
wonderful.
excellent. Thank you so much.
You're welcome.
Thank you, have a good evening.
No.
You too.
I don't see, well, there's somebody just says iPhone.
That's not clear.
Joseph.
It's up there.
Joseph. Oh yeah, Joseph's here. Yep.
Yeah.
So Joseph, you're from the Hilton Garden Inn,
I am.
okay? Could you proceed with your request for the variance, please?
So we're basically a small breakfast facility. We have a fryolator that is drained into a separate container that is handled by an outside company, and any bacon that we bake, the grease also goes into that same container, and it is disposed by this company as I have given a certificate that says that they dispose of it. We do have OmniPro, which also cleans our grease trap, but they very little grease, if any, in it at any one given time, because all of our grease is going to this company to be handled.
Okay, so you only serve breakfasts?
Pretty much, and all our pastries are store bought, not bought on site, and the griddle's basically used for pancakes and omelets. Very little grease is produced.
And on average, how many people do you usually serve breakfast?
30 or 40, to be honest with you. If it's really busy, we can hit possibly 80, but it's a small 30-seat place. It's not a large facility.
Okay. Karen, you have something?
Yeah, on this particular variance, well, all the variances go before the water and sewer superintendent. And both of them recommend that the variance not be granted, that they, have to install an automatic grease trap. So either an interior automatic or an exterior. So both, water engineer and our sewer superintendent recommend that the variance not be granted.
Okay, thank you. Have you looked into that possibility?
Of an external?
Automatic restrap, either internal or external, I guess, right?
Well, the automatic.
I have
internal-
not, but I could.
Yeah, the automatic would be internal. The exterior is 2,000. I don't think anyone is saying that is necessary, but, they are recommending that, an automatic internal grease trap be done.
Do any of the board members have additional questions? Nothing wrong with yellow?
It's a super loud.
Karen, why was that recommendation made? Because of the amount that they serve?
You're muted.
Either the external 2,000 grease trap or the automatic internal grease trap. In this particular situation, even though the cooking is minimal, according to the representative from the hotel, there is still grease that's coming from what they're cooking.
Okay. Thank you.
Understand.
Any other questions for, Joseph?
No, no.
Okay, so if there's no further questions, do you have adequate space for an internal grease trap there?
It's a small kitchen. I'm not sure that we do, but I will take a look and then, talk to my vendor and see what I can do.
Okay, so I think the best way to proceed, although we will take a vote on your request, would be for you to pursue, looking into that in more depth. And if there's any overriding problem in terms of getting an internal grease trap mounted, you can always come back to the board with that additional information and we can consider it then.
Sure, no problem.
Okay, so, would anyone like to make a motion? I think the motion, which would be appropriate at this time, is to, not approve the variance, subject to reconsideration if there's any additional complications for installing. Is that good enough?
That sounds, yeah, perfect.
Okay,
Awesome.
okay, again, Deborah, Meg, can you second that motion?
I'll second that.
Okay, if there's no further discussion, I'll call the roll again. Dr. Reed, yes or no?
Yes.
Meg, yes or no?
Yes.
Deb, yes or no?
Yes.
Myself, yes, unanimous. So, please look into that and let us know. You can just contact the department and let them know. If the installers or the vendors come up with any problem that we have to look into further.
You got it.
Okay, thank you.
Thank you. Bye-bye.
Next item is the Kevin Flaherty septic variance request for 79 Colchester Drive. You're muted. You have to unmute yourself, Kevin. We can't hear you. I don't think you can.
I can't. You can ask him to unmute himself.
There's movement going on. I assume he's fishing around to try to unmute himself.
He's on his phone. Now he's frozen.
Okay, Chris is here. Did you want to move on to Chris? While
Yeah, we
Kevin-
had to do Chris while we're waiting for Kevin to
His technical difficulty.
figure out his problem there.
Oh, he's doing something.
So Chris, you with us?
Chris is up
And,
and unmuted.
Hi, guys.
okay,
Hello.
just want to make sure we can hear you.
Yep.
Okay, so Chris needs a, septic, reduction setback for additional request for 25 Wellington Road. Chris, can you proceed with your presentation, please?
Yep. Good evening, Mr. Chairman and members of the board. Thank you for having me tonight. Are you guys going to bring up the plan? Oh, perfect. So I am here before you tonight representing the owner of 25 Wellington Road, Richard Tachi. And it's kind of a reverse local upgrade approval request, if you will. There's already an existing Title V compliant septic system on the site. We're not proposing any work to that existing system. But there is a home renovation project that we are currently in the midst of permitting through inspectional services and the zoning board of appeals. I'll briefly go over that. There's an existing 3-bedroom house located on this pretty small lot, 5,000 square foot lot. The applicant is proposing to do a second-story addition to the building, as well as 2 small addition bump outs in the front that you can kind of see labeled there, besides an existing front portion of the house to kind of square off the footprint. So there will be a new foundation poured in relation to those additions. And we are seeking a local upgrade approval request for reduction in setback from the existing leaching field, which is currently 12 and a half feet from the structure and will also remain 12 and a half feet from the new portions of that structure. So as I mentioned, existing system consists of a 1,500 gallon septic tank located in the rear of the house, which then feeds gravity to a leaching field consisting of concrete chambers with stone. And in order to mitigate that setback reduction, as we've done in the past, we are proposing to install an impervious barrier along the full front facade of that new foundation, and that'll be the full depth of the foundation to protect the event of any water working its way back towards the foundation. I do also want to mention that when this septic was repaired about 20 years ago or so, the Board of Health at that time did issue a very similar setback variance request, just due to the size of the lot. So hoping the board finds this request amenable, and I'm more than happy to answer any questions.
Okay. Thank you, Chris. Does the department have a recommendation here?
The department would recommend approval, not approving this particular setback would result in having the structure having to be torn down or moved. So I'm thinking that this is okay to approve.
Are there any abutters involved with this? No abutters needed. Okay. Does anyone have further questions? Deb or Megan?
No.
No.
Are there any wells that are affected?
I don't know if there are wells.
Is this property on town water or?
Yeah, it's on town water.
Water line.
Okay, so that's not impacted, yeah.
Okay.
Yeah, and I believe that water line was sleeved as part of the previous installation.
Yeah, so we don't have to worry about that. Any other concerns or worries on the part of the board members? No? In that case, would somebody like to make a motion to approve the variance request as stated? Dr. Reed makes the motion. Is there a second from Meg or Deb?
I'll second.
Okay, thank you, Deb. I'll just call the roll again. Dr. Reed, yes or no?
Yeah.
Meg, yes or no?
Yes.
Deb, yes or no?
Yes.
Myself, yes. It's approved. Thank you for coming, Chris.
Thanks, everyone. Have a good evening.
Thanks, Chris, you too.
See if Kevin has managed to problem solve. I think he did.
It's Mark.
It's Mark.
Mark?
Mark. Oh, Mark fixed himself, yep.
Yes,
Marcus?
good afternoon. Can you hear me?
Yes, now we can.
Okay, sorry about that. I was wondering if Dana could put up the screen, Dana? Thank you.
Yep.
So the project site's on Colchester Drive. Colchester Drive is in the Little Macaja Pond area. They're a bunch of relatively small lots. This is a 10,000 square foot lot on private well water. So we have we put a well sample into the laboratory, but we have not heard back. We believe we have good potable drinking water, but we can send a report when we have it down to the Board of Health. But what we're looking for is replacement of a leach pit tonight, and the right now the existing leach pit is in the backyard near. There's a circle on the back left, if you can see that. That leach pit is a little bit closer to the neighbor's well than what we propose. The variance that we're asking for is from the neighbor 81 feet to the leaching area, and from our own well we have 79 feet. And the second variance is because of depth, rather than 3 feet, we're 4 feet down. This seems to be the only feasible alternative to fix up this person's septic system. So thank you very much.
Okay, so the existing leach field, is it still functional or is it gonna be replaced?
We're replacing the leach field, doctor.
Okay, so, you will make appropriate, adjustments to make sure that the leach field has been thoroughly, taken care of.
That's correct. We have that note that any deleterious or bad materials should be removed along with the leach pit.
Okay. Are there any abutters involved with this?
There are, and they were notified.
No responses after notification?
No.
Okay. You didn't see anything?
No, they didn't pick it up.
They didn't even pick up?
They got, no, they never picked it up.
Hmm. Well, all you can do is try to notify them. If they
Yeah.
don't pick it up, you pick it up.
Yeah.
Okay, so if there's no further questions, Dr. Reed, do you have any questions with this?
You mentioned that, he's testing the well water now,
Yes.
so we don't have those results. Or,
Correct, he'll file those with us once they're returned.
okay,
Mhm.
So I don't think we don't have to make this a conditional approval based upon awaiting the test results from the well water.
No,
Okay.
okay.
Anything else, Meg or Deb?
No.
Meg, anything?
No,
Okay. Then would someone make a motion to approve the variance request as stated?
That's all.
Dr. Reed makes the motion, Meg or Deb, one of you to second the motion?
I'll second it.
I think that was Meg.
Yeah.
And I'll just call the roll. Dr. Reed, yes or no?
Yes.
Meg, yes or no?
Yes.
Deb, yes or no?
Yes.
Myself, yes. Again, unanimous with the 4 members voting present. With approved.
Thank you all.
Thank you, Mark.
thanks,
Thank you.
Mark.
We look
Yeah.
we look forward to seeing you again in the near future, I'm sure.
Okay, thank you. Yeah, bye.
Yeah. Next item on our agenda was a tobacco sales violation penalty appeal from Manamet Liquors. I was informed that they have decided that they're not going to appear to do that at this
Until-
meeting,
right,
but they
until
will at the
November.
next meeting.
Correct.
So that appeal has been postponed until the next Board of Health meeting. Because of the nature of the violation, I will be asking, either Bob Collette and or, Sheriff Bauer to also join us for that meeting. So we'll move on then to the next item. There was, I think I sent it to all the members, and I think I actually also sent it to you. The polystyrene regulation proposal. You didn't get it?
Probably did.
Okay. Well, several pages, so I've actually got it here, so I can probably. See if I can get at it. Yes. this out of the way. That's a thing that I sent you previously, but before we do the other part of it, I just wanted to point out that, in case you missed it, and down here in the text, they talk about, resources for behavioral support counseling are available through an app. And also there's an online, system called This Is Quitting that may be useful, I would hope. So this is the summary statement from the, polystyrene, takeout container, proposed ban. And we went back and forth trying to decide if we should put this in as a warrant article for the town meeting, in which case it would be a bylaw, or make it a regulation instead, which only requires us to hold a public hearing, prior to taking a vote on this. So, did everyone get this by email? Megan, Deb, did you see this prior before?
Yes.
Okay, so you know what it's about. So it's a little lengthy. Some of it was added, because I've been in consultation with, Ken Stone, who did our single-use plastic bag ban previously. So we do have to have some exemptions for this. The primary exemption, is because apparently, seafood, there is no option, for containers other than styrofoam containers. But that's not for the restaurants, that's for the seafood industry itself. So this applies to all the restaurant establishments. There is some, information here about they can apply if they wish, for a waiver. If there's some overriding reason why they must use polystyrene, also known as styrofoam containers. They're usually these clamshell things. They close up and they're made of styrofoam. The problem with the styrofoam is that, it can't be recycled. It breaks down very easily. And as you saw, or you might have seen, styrofoam leaches styrene into the foods and beverages that the container is holding. And it just so happened that styrene is a carcinogen. So we are going to try, and this is not just us alone. There's been a number of towns and cities that have followed this kind of styrofoam takeout container ban. As you go around to restaurants, you probably have noticed that some provide like little reinforced cardboard containers. And others provide these containers that have like a black bottom with a translucent top. They are not made of styrofoam. Obviously, the cardboard is probably actually compostable. You can't really recycle stuff that has food residue in it. But the black bottoms, I was told, cannot be recycled. The translucent top can be. The reason being that the machines that read that little triangular thing that has a number in it, they cannot read it if it's made out of black text. So everyone should be aware if you get one of those, although it would be within the realm of what's permitted. We do recommend that they not be used if you can't recycle or compost them, but we're not gonna make that a requirement. But if you do get one of those black bottom things, don't throw it in the recycling. Because
To know, because I have.
I know.
Here I thought I was doing something.
Yeah, no, everybody thinks they're doing the best they can, but then you find out that when the stuff gets to the recycling center.
Yeah.
And the machines find that they can't read something, that means it has to go into the trash. And in some cases, that means the entire truckload goes into the trash. Oh, yeah. So it's worth being cautious about that. So this is basically what is going to be, oops, let me try to get just a little bit back up. So, those are the exemptions. This is the prohibited use and distribution for food, ware, and packaging. Food establishments are prohibited from dispensing food and beverages to any person in takeout disposable food containers made of polystyrene, also known as styrofoam. Food establishments using any alternate disposable food service ware are strongly encouraged to only use biodegradable, compostable, or recyclable food service ware. All foods establishments are strongly encouraged to utilize reusable food service ware in place of disposable food service ware for all foods served on the premises as well. Because sometimes, I believe this happens at some of the seafood restaurants. Sometimes you order something to eat at the restaurant and they bring it out in a polystyrene styrofoam plate. So they wouldn't be able to do that anymore. Plastic straws and utensils are not really recyclable and they should only be provided upon customer request. So this is in there not because they're necessarily styrofoam, but they are not recyclable. And we thought that from our previous discussions about this topic, that this would actually save the restaurant some money. Because if they only give these things out, which are not recyclable anyway, unless someone asks for them, then obviously their usage for these things would drop. And you know, that includes not only knives, forks, and spoons, but also plastic straws. There are alternatives for that can be used and are being used in some other restaurants. So each food establishment is defined above, and I skipped all the definitions because it takes too long. Operating within the town of Plymouth shall comply with this regulation. Any food establishment violates any provision of the regulation as established by the Board of Health shall be liable for a fine as follows. First offense, warning. Second offense and subsequent offenses, $100. Each day a violation continues shall constitute a separate offense. So, question for the department. To put this in place, do we have to have select board approval?
No, but I'm not gonna do part B. So
Okay,
if Ken Stone wants to hire somebody and pay me or put it in my budget, an additional person who's going to do that, then by all means, I would be more than willing to do that. But as of right now,
well, I think this was in there under the assumption that someone would phone into or email into the department with a complaint.
right, and we would still have to follow up on that.
You would still follow up on that, right?
Yeah.
Because I keep telling everybody when it comes to enforcement, for the most part, the department acts on complaints, so it is complaint driven when enforcement is needed. Certainly that's what happens with our underage sales of tobacco. So we're not gonna go running around and trying to, you know, recruit a high school student who's not yet of age to attempt to buy nicotine or cigarette products. Because we have a service that does that and they actually hire somebody to do it who's not of legal age to buy this stuff. And most of our towns, you know, say, well, we can't do that, you know. How are we gonna do that? And you know, you have to pay the student who's doing it. So that's not gonna happen. Should we change this wording to read under B? Where is it? This regulation shall be enforced by the health agent or their designee. Subject upon receipt of a complaint and may be penalized. By would that make it better?
Let me think.
We're not gonna vote on this today anyway.
Yeah,
You can
let me
find
think
it.
about that a little bit, yeah.
So the only thing we have to do today, and the effective date would be 6 months after approval by the Board of Health. That gives the restaurants time to get rid of their stocks.
Right. Is this just for the restaurants?
Any food service,
So
Business.
nursing homes?
I think it would apply to nursing homes too,
Well, that's what this says right now.
Yeah.
Yeah,
because I didn't,
Because I know there are nursing homes that are styrofoam.
Right.
Well, the point is to get everyone to switch to something which is
Right,
not gonna be hazardous. And I would think if it's a nursing home, they wouldn't want their residents eating food which had been prepared and put into a styrofoam container, which leaks styrene into their foods.
So every food establishment include nursing homes, the hospital, schools, camps, anything, and not just a restaurant per se that you would think of when you think of a restaurant going out to eat. It would include anything that's a food establishment, any establishment that serves food to another person.
So I have to ask Eric, at the school cafeterias,
Yes,
do they serve food or beverages in a styrofoam container?
I don't believe so, no. I think pretty much at this point, all the trays that we have are some form of paper or cardboard. But I know a couple years ago we did have the styrofoam, but I think we've kind of moved away from that since then.
Okay, that's a good thing.
that's good.
Yeah,
So all we have to do tonight, is because this kind of regulation does require a public hearing. And we will invite businesses to come to, restaurant owners, and the Chamber of Commerce. Because that's what we should do. So there will be some environmental people present too, but we're gonna have to schedule a public hearing, but to do that, I need the Board of Health to authorize it. So would someone make a motion to, schedule at a date to be announced, a public hearing to review, the details of this proposed styrofoam ban regulation?
I saw,
So Deb and Meg, would one of you care to second that motion?
I'll second.
Yeah, I
I
just
would just-
wanted to add, I remember we were discussing this a few meetings ago, and I think somebody brought up the example of like a grocery store selling like styrofoam coolers, and then we got into the discussion about styrofoam is toxic when heated. So, or I don't know,
Yeah, well, the problem with that, Meg, is that usually it's hot food and beverages that are put into those containers. And as far as the grocery stores, this says nothing about the grocery stores being banned from selling the styrofoam coolers. They can't. The reason why we took that out is simply because it would probably be very difficult to enforce. Because obviously if people want those things and they can't get them at their local business, they are simply gonna go to their neighboring town and buy them someplace else. And then our businesses might suffer loss of income.
so are so grocery stores are not considered food establishments?
Well, grocery stores can be food establishments if they have snack bar operations within them.
a deli,
right, so ready-to-made foods, things like that are food establishments, but if they were selling a styrofoam cooler empty. That would not be considered a food establishment, that would be part of the retail market. So the food establishment would be ready-made foods. It would also be things like, the rotisserie chickens, anything that you would get at the deli, things like that. So anything where food goes from one person to another would be part of this. With the styrofoam cooler, you would have to put food into it yourself, so it's not a person to person transfer, it's a person to container transfer. Very similar to if you wanted to bring your own to a restaurant, you could use your own.
Yeah.
So if you had a bazillion styrofoam containers for some reason at your house, and you really like to use them, and you want to bring those to a restaurant to take your leftovers home in, you could.
And you can also bring your own, you can get glass containers that have a plastic top. And say, well, I'd like to bring this home and say, here's my container.
Yeah.
And I believe, although they're probably not required to do that, I think most places would honor that request. It's not a problem for them, I wouldn't think. Any other questions, Mike?
No, I agree with the movement. I just was that stuck in my mind from a few meetings ago.
Well, this sort of ban, most of the places that have done this are cities and they passed it as an ordinance. And we thought about doing it as a bylaw. The problems with a bylaw are that it has to go through a lot of steps. It has to go through, precinct caucuses, of which there are 18. It has to go through advisory and finance committee. It has to go through the select board. And then it has to go through the town meeting, which is only held twice a year. And so it would be probably a pretty long process trying to put this in place if we went that way. The advantage is that once you have a bylaw for something, it can only be changed by going through the same multi-step process again. Whereas a regulation, if we found out something was causing a problem with this regulation, the Board of Health could consider just amending the regulation. We don't have to go through all kinds of contortions to make a change. And as a matter of fact, is what we did with the short-term rentals. Because we had the same issue. So is there any further discussion? I just need, we've had a motion to authorize a public forum at a date to be announced. It was seconded. Dr. Reed, yes or no?
Yes.
Meg, yes or no?
Yes.
Deb, yes or no?
Yes.
Myself, yes. So in terms of a date, I think the last time we had a public hearing, we just shoehorned it onto a regularly scheduled Board of Health meeting.
We did. You will not be able to do that in November.
Right.
Yeah,
There's
we
too
have
many things
too
going
many
on.
things already, yeah.
So do we have a problem that you foresee about the Board of Health having an awful lot of variances and grease trap variances and also, you know, tobacco sales violation penalty appeals? Is that gonna happen a lot? I mean, is there an awful lot of tobacco violations that may be coming before the board?
No, but you may get more, grease trap variance requests because that's supposed to be done by the end of December. So every food establishment should either have an external grease trap or an automatic internal grease trap, or seek a variance from the board that's been granted. Those are the only three options that, if you're on town sewer, I'm sorry, if you're on a septic system and you wanna ruin your septic system, that's up to you, but this is if you're on town sewer. So we may get an influx of those types of requests between now and the end of the month, which is the November meeting and the December meeting. So I guess my advice to the board would be to wait till January.
Okay, so we will schedule it at the next possible Board of Health meeting as part of the Board of Health meeting. Most likely, if not in December, in January.
Yep.
Okay. For which we may need a larger room.
Yes, and I will start working on that.
Okay, next item for our discussion tonight is going to be, testing for lead, so I've been busy with that too. I'm gonna skip through this because we should have, at some point, Devin is supposed to join us remotely tonight. Is she on yet?
He's not gonna be able to do that, she doesn't think.
Okay,
Yeah. So I talked to her today.
okay, so we'll just skip that for the moment, go on to the lead. So why are we concerned about lead? Dr. Reed, what is the problem with people consuming even small amounts of lead?
The problem with lead basically is that it gets into your body and there's no way for it to get out, and it has a particular propensity for fat. And that happens to be what the brain is mostly made out of. So you're gonna get a lot of lead toxicity in the brain and a growing brain.
Yeah, so it's a big problem for, you know, children and even adolescents.
Yeah.
So you see more information about that. I dug through to see, well, where's the lead coming from? So,
I'm sure we have a lot of lead pipes.
well, we do, and you'll see, you see, if you look at the text of this, if you can see it, gets into the drinking water when plumbing materials that contain lead corrode, especially where the water has high acidity or low mineral content. I believe our water supply here in Plymouth, most water supplies are a bit on the acid side. So most common sources of lead are the lead service pipes that come in from the street where the water main is located. Faucets and fixtures in homes with lead pipes connected to the home to the water main, also known as lead service lines. Pipes are often found to be the most significant source of lead in the water. And lead pipes are most likely going to be found in older cities and homes, especially those built before 1986.
That's like-
I'm
that's
assuming, I'm just jumping to the conclusion that there is an awful lot of lead service pipes. Because we have a lot of homes that were built before 1986. I also asked the water superintendent about that. And Peter said, oh yes, as a matter of fact, the state has mandated that we have to do a survey. I assume they just checked the age of the homes and assume they have lead service pipes. And he said, I've started doing it so far, and I just started, I found 500 homes that undoubtedly have lead service pipes.
Oh, gosh.
And there's gonna be a lot more than that. Also relevant to this is President Biden just announced that he was going to require that all water companies do something to remove lead pipes from the water systems within 10 years. I don't know, has anybody had experience removing pipes from the water main coming into your house? I did.
I bet that was fun.
I lived in New Jersey, my home was built in 1918. All of a sudden I noticed water coming out near the curb in front of our house. And I looked at it, and of course I called the water company, and they said, we'll come out and check it, but if it's the water line going into your house from our main, it is your responsibility. At which point they said, here's some companies that can do the necessary replacement for you. So we called one of them. I think it cost somewhere in the thousands to do it. They came in with a backhoe, they dug up a big long line of our front lawn. Down to a depth of maybe about a yard. So there was this big gun. And they pulled that pipe out and they put a new non-lead pipe in. And it took a while until everything looked back to normal again, but in the meantime, we were probably consuming quite a bit of lead in our drinking water. And it was town water. But fortunately, we were nowhere close to the age when it is the biggest problem. So I did get worried about our cats.
They crazy?
Yeah, I said, oh my gosh, what's gonna happen to the cats? So there is a safe water, this thing is causing a problem. Get rid of this. I think I.
So this proposal that Biden has, is everyone gonna have to pay for it themselves? I mean, that's gonna be expensive. What you say is true.
Well, yeah.
Obviously, it was true for you.
It was. So, not only did we have that problem, but we had heating oil powered furnace. And we're getting ready to sell the house, and they did an inspection, and they said, there seems to be oil residue in your backyard. Well, then the state DEP got involved. And they started digging around and they sampled the soil and they said, yep, there's heating oil in your soil. So then somebody came in with a gigantic backhoe. Dug up the backyard. Pulled out this gigantic heating oil tank, which was an in-ground heating oil tank. And there was a hole in it the size of my fist.
Ooh.
No.
And they said, well, but we had insurance coverage through our heating oil.
So that was good.
That was good.
So it didn't cost us anything, but it could have, that's for sure.
Well, the good news is that pediatricians, if they're doing their job, check, screen for lead. and kids, and there's certain ages that we look at it, and so. And if it's high, we have ways to rectify it.
You can also go onto the Quest website and request lead testing. I think it's like $50. Just for
what-
anyone who's not established with a pediatrician.
I seem to have lost on my screen, so I don't know if I can do it, but I'll try.
This is blood testing of the person, not water testing.
I didn't hear the second part of what you said. It is a blood test.
Yeah, it's not water testing though, it's not testing the
Oh,
water.
I'm sorry. Yeah, no, this is just, no, it's not water testing. It's just for children if they are required for lead testing before going to school or camp or whatever the case is. If they're not established yet and they need it kind of quickly, they can just go onto the Quest website and purchase it. I think it's around $50.
But I did my homework. And there is a test for lead in drinking water. You can purchase it either from Amazon or like home stores. And there's a variety of them that are manufactured by different companies. There is one that's an at-home test. I believe it's about $16 for the test kit. All you do is you take the water, you put a little dipstick into it. And you know what dipsticks for, because that's what you use for urine tests.
Yeah.
You pull it out and you wait 10 minutes, and if it's positive, there'll be a band that shows up. So you don't have to head to a laboratory. And then I looked a little further, and there are other test kits made by other manufacturers for drinking water, and they're less expensive. But then you have to send the sample of the water into a laboratory. And the laboratory charges you at least $40 to do the test. So it's less expensive and it's actually pretty reasonable, to buy the test kit, and they're available, I know at Home Depot, I assume at Lowe's, and most of the other hardware stores have them. Probably somewhere near the radon test kits.
Well,
And they're easy to use.
I would say that people that have young children living in their houses.
I think so
should for
too.
Sure, get a test kit,
Because it's quite dangerous for young children.
yeah.
And can they chelate the lead to get it out to them? Because that's the only way you can get it out, I assume.
Let's say IV chelation.
Yeah, nasty. So, anyway, that's the concerns about lead.
Does anybody know if reverse osmosis filters will filter out lead?
uh, I would think they might. Certainly the usual sort of filters you put into your water supply from the faucets. Brita filters, or if you have them built into your refrigerator. If you have water supply coming out for drinking water from your refrigerator. I'm not sure about those are a little bit more advanced filtration systems. But
Yeah,
if they're based on activated charcoal, I don't think they would remove lead.
The Brita actually has a lead removing filter. It will remove 99% of lead from the water and last for 6 months.
oh, okay.
Yeah.
And so I think the recommendation that seems to make sense is to get one of the $16 lead test kits, especially if you have children in your home. Test it, and if the test comes out positive, look into, instead of digging up your front yard and replacing the pipes at your own
Right.
expense.
Filter.
Maybe get the filter that takes out 99.9% of the lead. Be a bit of a pain because you'd have to do it for all the water that's been used for drinking.
It says it does
It does,
effectively remove lead from water.
but that's better
Reverse
than the alternative, for sure.
Thank you.
Okay. Next thing I want
Leave this
Okay.
meeting, sorry, but I need to jump on another meeting. So,
to,
That's right.
that's all right, we're not taking any more votes.
all right,
um,
thank,
Thanks, Deb.
Thanks for coming. So the other stuff we wanted to talk about a little bit, is pertussis, also known as whooping cough, hepatitis B and C, COVID, influenza, and RSV. So all of those things are preventable by vaccines. Most people probably had DPT vaccinations as a child, which means diphtheria, pertussis, and tetanus. Because I believe it's required for admission to school, isn't it?
Yeah.
It's probably also required when you start anything like college.
Yeah.
I would think. So question came up, isn't that a lifetime immunity? And the answer is nope. They're usually, if you've had that vaccine, it probably protects you for about 10 years. And so at some point, at least 10 years after you first got it, or the second time you got it when you started college, you probably need to get a booster. So that's it. Adults can get it. Adults usually have a pretty serious bout with it. I know a couple of people that had it and they must have been coughing and hacking for like a solid month. And it doesn't seem to go away. And it's a pretty miserable thing to put up with. It's also extremely transmissible. So again, if you happen to be an adult who only had the entering school DPT vaccine, and now you have children in your home, you probably don't want to get whooping cough and take a chance on giving it to them. I assume, is that something they recommend for people during pregnancy? You know,
Not per se.
because I don't even know that it's gonna be a while after childbirth before the child is going to probably receive that vaccine. When do they usually administer
They
it?
get their first one at 2 months.
2 months?
Yeah.
They would get DPT at 2 months. So there's only a 2-month gap when they might be susceptible.
And they probably get some immunity from the placenta,
Yeah, that's why I asked about, that's
Yeah.
why I wondered about,
but they don't like give it automatically when you first become pregnant.
no, but I suppose someone who was anticipating.
If it had been a while,
If it's been a long time, it might be worth doing.
same with any of them, tetanus.
So, Devin, who couldn't join us tonight, but she actually looked through a lot of data for the town of Plymouth and other towns. And she found 3 things that really seemed to be of concern. One was hepatitis B and C. And there are ways you can get hepatitis B and C. You can get them from dirty needles and syringes. You can get them from reusing, syringes that have already been used by someone else. You can get them from using those things for drugs, for administering drugs. And you can get it from unprotected sex. Is there any other way you can get that?
Well, it's a sort of a subtle thing to think about, that if you touch, let's say someone has a bloody nose, and you're gonna help them, and you happen to touch their blood, they have hepatitis B or C, and you happen to have even a little tiny cut in your skin, that virus can get into your skin, which is why we universally protect ourselves in hospitals from blood products by wearing gloves all the time. We don't think about that on the playground. There's all kinds of scuffs and bloody noses and owies that occur that we wind up helping people with, and that involves blood. And one of the things that I like to remind people is that this particular vaccine, the hepatitis B vaccine, is a vaccine that not only prevents that virus, but it also prevents a type of cancer that you can get, a liver cancer, that you can get later on in life if you haven't been protected from it. So you're kind of getting a 2-in-1 thing. But and I'm very concerned about unprotected sex. That's the other thing that I think we've sort of forgotten about. Because we don't look at it as a sexually transmitted disease per se, but in a way it is, because that is how you're getting it. So,
Yeah, it's risky, but it also depends upon what you do for a profession. So if you were a doctor or a physician's assistant or a nurse,
yeah,
or in my case, I worked for 6 years in the Army Reserve as a medical laboratory technician at an Army hospital 1 weekend a month. I can't even count the number of bloods I drew, the number of tests I ran with blood. And eventually, out of the blue, the lab director came over to me and he said, "We're gonna test you for Australian antigen." I said, "Well, okay, what's that?" He said, "Well, you would have this antigen if you've been exposed to hepatitis. And we cannot discharge you from the army until we're sure that you're not gonna make a claim against the military."
the bottom line.
Test me for the antigen. Yeah, you're always afraid of that. So the other things that came up when Devin looked at this stuff was in this, I saw your concerns about alcohol consumption. Devin found that there was an unusually high amount of binge drinking going on in the town of Plymouth. More so than other towns. I don't know if you would be aware of that. Depends on who you hang out with.
Yeah, for sure.
But certainly in college, I saw an awful lot of binge drinking going on.
To an extent, I think it's on the high school level, it's, I think, a little harder for kids to access it compared to I don't even know how they get it, but a lot of them have older siblings that manage to smuggle something into them. And I know a lot of kids, especially like the higher grades with more stress and all that, they tend to go to the alcohol more in order to relieve stress, but.
Well, I know how people used to get away with it when they were too young to buy it. They had a friend who had a legal ID. And I saw a couple of places, I went to a nightclub with some friends. I was too young, I didn't want it anyway. But all of a sudden I saw somebody who went in and had their IDs checked. And then sent their license back out with somebody else. And handed it to their friend who was not of age yet. And of course, the person who was checking IDs didn't bother with his pictures.
Just the dates.
Yeah.
So
Yeah.
that's
What's
another
the
concern.
definition of binge drinking?
I guess I would have to Google that to find it.
I bet you would be surprised how little it is.
I mean, I would imagine it's a certain amount of drinks within a certain period of time.
Yeah.
I mean, obviously, if you are drinking.
4 drinks within a couple of hours. I don't think the average person on a Friday night is gonna consider that binge drinking.
Yeah.
This Sarah, who joined us remotely, said binge drinking is more than 6 drinks by definition.
6, interesting.
Thank you, Sarah. We see your name.
It actually is done more medically. It's if your blood alcohol concentration is 0.08 or higher. So this is usually achieved by drinking 4 or more drinks from women or 5 or more drinks from men within a couple of hours.
And that probably occurs in bars.
Yeah.
A lot. I would
I
think.
would think.
I would definitely think.
Why else would they go?
I would think even if you went out to dinner and you had a couple of glasses of wine with your dinner. That's why Devin and I actually talked about this, that the definition of that, I think, is when someone's answering that question in a survey and they actually do say like what it means, like, do you have this many drinks? They don't say, are you binge drinking? They ask you, how many drinks have you had? And then they check off that box. Then when the data is collected and analyzed, then it's actually said that that box represented binge drinking. But if you think about binge drinking in your head, you're thinking probably more like the college atmosphere, you know, go, like really drinking very quickly one after another. But 0.08 is not that difficult to obtain.
Mhm.
And I always wonder if they take our population size into account. The town of Plymouth is large, you know, we have a large population. How does that compare to surrounding towns?
In public health, the way that's usually dealt with for most medical conditions is it's per unit population, usually per 100,000 people.
Yeah,
It's
but
also-
like, and then our ratio of like restaurants and bars compared to,
Exactly. Yep, and it absolutely, Megan, it's also who's answering the questions.
right,
Do you know what I mean? Like, when we talk about these things, I think it's really important that we have to really get to who answered these questions.
Right.
You know what I mean? How many, what's the percentage of men? What's the percentage of women? What's the age demographic? You know, what's their socioeconomic background? I mean, these are all the things that are gonna paint the full picture. Instead of just saying that a certain percentage of our population has binge drinking issues.
Yeah, so that was the second thing that Devin came up with. The third thing was that, the town of Plymouth, along with, I think, Nantucket Islands and at least it used to be the town, some of the towns out in Boswell County, all seem to have a higher than average number of incidents for cancer, certain kinds of cancer. And so the reason for that, there's an awful lot of stuff that causes cancer. The only thing I found recently that seems to fit with Nantucket and the islands and Plymouth and parts of Cape Cod is the sandy soil.
The what?
The sandy
Sandy
soil.
soil.
I mean, whenever you do a test as part of septic
Perk
procedures,
test.
perk test,
Mhm.
every time I've seen the results, it always it says soil sandy first.
Mhm.
Yeah.
So we live near the water, of course, we're gonna have sandy soils. Problem with sandy soils is it leaks stuff through it like a sieve. Goes very rapidly, so if there's anything in the groundwater which contains a high concentration of something that might cause cancer, it's gonna go into the groundwater from the surface water, then it's gonna go into our aquifer. And then it's gonna get consumed. So that might be one reason. Beyond that, you know, I don't even wanna speculate, because there are so many things now that have been identified as carcinogens. There's pesticides, there's herbicides, there's food additives, you can make a list that's probably a half a mile long. Certainly the PFAS that, you know, they identified in the non-stick surfaces is a major health issue now. And,
Speaking of Nantucket, see that those people are suing.
yep,
There's a group of families on Nantucket that are gonna be suing because of the level of PFAS in their drinking water. Yeah, and they're tracing it back to a spill that occurred that fire department used foam. And it leaked into their wells.
yeah. Well, the same thing happened in Duxbury.
Yeah.
Because they had fires at their closed landfill and the fire department used foam. And lo and behold, the stuff that they put into the landfill worked its way down into the water supply for Duxbury. At least one of the wells. The people you're talking about, I read it, and they're private well owners.
Yeah, yeah.
We have a lot of private wells, in the town of Plymouth. And I got immediately concerned because there was an older, program where they tested private wells in some towns, but not others. It was a state-run program. And they were testing for PFAS. And I actually have the data for that for the towns in our public health excellence grant group. That got tested. And yes, the PFAS concentrations in some, but not all the wells were way above the limit. And certainly if I were in that situation, I would wanna know. So of course, I called the test company that runs the test for PFAS. And I said, can private homeowners submit their water from their wells for testing for PFAS? And maybe about a year or two ago, they said, oh yeah, we can do that. It's expensive, but we can do it. This time I called and they said, oh, we can't do that anymore. We don't have the capacity. So I'm hoping the state at some point will start more extensive testing, especially if the wells are located around some area that might have been exposed to like firefighting foam. airports.
I was thinking about Otis, is that?
Notice they had a big
what
problem.
wants to-
So
Okay.
I was thinking about the
That's
Plymouth
yeah.
airport. I mean, do they practice fire suppression at the Plymouth airport? I bet they do. Did they use the foam? I bet they did. So, no, I think when this comes up for further discussion, we should probably ask the fire chief to come in. And give us an update if he can find any data. Where was the firefighting foam being used previously? I assume that they don't use it anymore, but I would ask him.
No, nobody does.
Nobody
You
does.
can't, in the state of Massachusetts, use the foam that they used, that had the problem.
But, you know, where was it previously used? Do you have a list of locations? Well, if it was used in it, I mean, they don't always use foam to fight home fires. I mean, they usually just use water.
No, I meant everywhere, not just Plymouth, I meant everywhere.
Oh, yeah, I mean, it's been widely
Yeah.
used.
So I think I
So-
brought this up in another meeting, but the cancer data is, it's a little wishy-washy, like, wherever people live when they're diagnosed is obviously where that's documented, but just by the nature of where we live, a lot of people retire here. Although they could have spent their entire lives in another state out west, and they come to retire to Plymouth or Cape Cod or the islands, and then, you know, something happens and they get diagnosed with cancer, it impacts our numbers as, you know, our cancer rates here, although maybe it was something where they previously lived that contributed to the diagnosis.
Well, of course, but you know, the stuff I've seen actually is age-adjusted data. Because it's obvious that as people get older, there's a higher incidence of cancer usually. That seems to be changing a little bit for certain kinds of cancer now in younger people, unfortunately, but it is, and we don't know why. So you know, what, we can ask Devin the next time, you know, she comes to one of the Board of Health meetings to look into this a little further for us. In terms of what did this data mean? We do know, because I've talked to Devin a lot about it, and I've talked to the DPH about it. The data we have for cancer incidents by town or city only goes through 2015. And numerous requests have been made for,
Years.
yeah, I mean, that's almost 10 years.
Yeah.
Obviously, cancer incidence has gone up, even though deaths from cancer has actually fallen in many cases because of early diagnosis and better treatment options. But, you know, it's important to know what's happening over a period of time to cancer incidence, so you know, well, this is happening, this is going up, and it's still going up. We gotta try to figure out what's going on. So that's what, you know, I know Devin gets all excited about that kind of stuff, and so do I. That's what we do. The other things I want to bring up, the COVID vaccination. Just got the new COVID vaccine myself and my wife. While she was waiting for me to get mine so she could get hers, she was chatting with somebody who'd gone in to pick up a prescription. And the woman said, "Oh, are you waiting, you know, for a prescription?" And I said, "No, I'm waiting for the vaccine." "Oh, well, I got the COVID vaccine about a year ago, so I guess I'm protected."
No, this is a new one.
My wife has now been around me so long. She took the woman aside and said, "You are not protected. 2 reasons. Number one is the virus keeps changing,
This is a new one.
and it's not, the new one is not anything that the new vaccines were designed for this time. They've been designed for the newer variants. And the other is protection only lasts and starts to fade away in 4 to 6 months. And so, do you need a new booster? Yes. Absolutely, positively, you need a new booster.
I just got mine.
Yeah. And then I started thinking about flu, so I went back and I got the flu shot. It's the same thing, the flu keeps changing, I mean, it changes itself, and the vaccines from 1 year doesn't necessarily work for the next year. And that's why they keep changing it, although it's a much more complicated process now for the flu vaccine than it is even for COVID. Because of the way they make the vaccines.
Yeah,
So do you need a flu vaccine every year? Yes. Will everybody get it? No. And I found out today, listening to the DPH thing for local boards of health, that mobile vaccine clinic, you are not allowed apparently, or maybe it's the home vaccine service. You are not allowed to get just flu. You can get the COVID vaccine or you can get them both. But they will not administer flu only. So it's worth looking into to make sure.
Yeah.
I didn't know that, so, really? RSV vaccine, it's a fairly new vaccine. It's supposedly for people who are immunocompromised. Immune system's not working very well, or for those 75 and older. It is very infectious and it can be dangerous under those conditions, but it's another one of those molecular, mRNA vaccines, I believe. And, when you ask about that, usually you get mixed opinions about whether or not you should get it, but it's personal.
well, if you're a grandparent and you're going to be around little kids, especially babies. And a lot of grandparents are the caregivers for babies, the nannies for babies. If a baby gets RSV, they get very sick and there's no vaccination for them. So if you're gonna take care of your grandchildren and their babies, you should get it.
Yeah, and as I kept telling all of my pre-med students. Because they would always ask me, I said, so. Can't you get, isn't there some kind of, antibiotic that takes care of virus diseases? No. Antibiotics only work against bacterial infections. And antiparasitics only work against fungal infections. And we are up the creek when it comes to viral infections unless you get a vaccine. And those are pre-med students. So, and they went up to medical school and I made sure that they knew the difference. So that takes care of all those things. Director's report, Karen, can you
Sure.
remember, I wanted you to, if possible, talk about the shops disposal.
Yep, that's gonna be in there. Our mosquito testing and surveillance concluded on October 10th. Limited risk of mosquito-borne disease transmissions will continue for the next few weeks. There's the updated numbers that we have for West Nile virus and triple E. We originally here in Plymouth did have a no activities on our own Plymouth-owned parks, fields and beaches, but that's been lifted. So now the dusk to dawn, no activity has been lifted, so the parks, fields and beaches are now open. So there's the numbers that continue for all of the items that were tested by the state of Massachusetts this year. So we can look at that one last time and until next season,
Just to clarify, though, as a heads up, the mosquitoes that carry West Nile virus,
November,
they do not die until you have a hard freeze, which means the temperature's gotta go to 28 or below.
right? But they will not be reported any longer by the state of Massachusetts. So this is it. This will be the last report from the state of Massachusetts, but that is true. The West Nile virus tends to stick around until November.
Different kind of mosquito, the ones that carry AAA, I guess, are pretty much done now.
Yeah. So couple of exciting things. The South Shore Recycling Cooperative with the Plymouth County Mosquito Control and the towns of Plymouth and Rockland are teaming up to have a tire collection. So all those little mosquitoes that hang out in the water that's in your tire, that's in your backyard, well, you can get rid of them on Saturday, October 26th from 9 to 1 in Plymouth. Now, there is a limit to 2. They are only off-rim auto and pickup tires. And you must be a member of either Rockland or Plymouth. And you can call the phone number or scan for more information. And then also
And
that,
registration is required for that.
Yep.
right?
And also they're doing a propane tank recycling. Now, this does cost money. On Saturday, October 26th from 9 to 1, you can bring in your propane tanks that you no longer want to use, or your fire extinguishers that are no longer being used. There is a cost associated. 1 pound to 30-pound propane tanks will cost from $2.50 to $4, and a fire extinguisher costs $8. And to register and pay, there's information on the flyer as well.
Yeah, I should add, because I asked over at BJ's, when I was filling a propane tank, they have expiration dates on them,
Mm-hmm.
and they're printed on the top of the tank with
Mhm.
near where the handle is. And so when they fill them, they routinely look at those dates, and they won't fill them if you're beyond the expiration date.
Mm-hmm.
But if that happens, of course, they say, we'll take care of it for you. We'll take it and recycle it, if you buy a new tank.
Sort of like when you buy a new mattress and they take the old mattress away. Public health nurse numbers for September, 31 cases of Lyme, 1 case of the flu. And I thought it'd be interesting to take a look at year-to-date information for Lyme. In 2023, we had 292. In 2024, we had 228, so that went down, but flu in 2023 was 266, and year-to-date in 2024 is 465. So a big,
Maybe
Yeah.
a big year for flu.
yeah, so definitely. Cyanobacteria advisories, Clear Pond is still having cyanobacteria advisory. Big West Pond and Little West Pond have both cleared. Great South Pond has cleared of their bloom, but now their 2-week window has started. It's not cleared until that 2-week window is over. And Billington see the same thing. The bloom is gone, but now the 2-week period has started for no visible bloom is needed to approve of the lift. Now, great news in the Public Health Division. We are awaiting the delivery of our new Chrysalis kiosk. So what does that mean? That means that our residents will now be able to bring their shops in appropriate shop containers and place the container in the Chrysalis kiosk located inside the public health office here at the town hall. The kiosk will be available when the public health office is open, so the same hours as town hall. For current shop collections, and while we're waiting the delivery of the kiosk, which we hope will be here by November 1st, residents can reach out to BAMC Health, which is on Court Street. You can go there Monday through Friday, 10 to 3. I would advise calling first at that number 591-3870 to make sure someone is indeed there to accept your shops. But we're very excited. It will be right in our office as soon as you walk in. And then residents can bring in their shops to dispose of right in our office. So we're pretty excited about
Does it
that.
have a large capacity?
It will be picked up every week and emptied, but I can always call if it does fill up, so to speak, and have them come back out and pick it up. So we're excited. And that's the end of my director's report.
Could also point out, because Devin isn't here, but she gave a lot of statistics about whooping cough. And whooping cough is among the respiratory viruses like flu that seems to have shown an unusually large peak after a trough, which occurred during the pandemic. Reason is pretty obvious to everybody.
Yeah.
During the pandemic, everybody was being cautious. A lot of people were wearing masks. A lot of people were trying to avoid being around big crowds of people. And now people aren't doing that anymore. And so where you might have been exposed to those viruses and developed some resistance, that was like, what, 2020,
Yeah.
2021? So during the 3 or 4 years when the pandemic was roaring, you weren't getting exposed to any respiratory virus as much as usual, so you had no immunity.
Yeah.
And so now our immunity is and the viruses are rubbing their little tail fibers together. Their little absorption things that you grab onto yourself.
Yeah.
Because unless you get a new vaccine, we don't have much protection. So I don't have anything else. We do have to decide upon our next Board of Health meeting. There seemed to be quite a bit of, board members that felt, given the holidays, we're best off going to the first week in November and December rather than the third week. But as I told everybody who asked me, I'll put it to the board. So, need to find out, well, Deb's gone, but Meg's still here. Meg, do you have any issue with the meetings for the next 2 months being the first Wednesday in the month at the same time rather than the third?
I don't have any issues. I'm around, so
Okay,
flexible.
Oh.
I will be around too, Dana and.
We'll be here whenever you want us to be here.
You should never say that.
Either the first or third Wednesday.
Dr. Reed, what do you
Karen, I
say?
did have a question though.
Sure.
Do you have any vaccine clinics scheduled in the community, or do you just rely on like providers and pharmacies and?
We don't have any scheduled here. We are having, I believe, a mobile clinic at Algonquin Heights for that, that the people who live there, but nothing here at the town hall.
Now, it doesn't mean that there might not be another one or something.
Yeah, we did try, to be perfectly honest with you. We were holding a flu vaccine clinic here, but nobody pre-registered. So the folks that were coming to do it needed at least 15 people to be pre-registered before they would come out. And we didn't have anyone pre-register, so we had to cancel it.
I was wondering if we could induce the Center for Active Living to request one.
I don't know, depends if they feel that their people need it.
Yeah, because I think what was found before was that most people, when you asked them, already got it if they wanted it,
Mm-hmm.
and they went just like I did, to CVS.
Yeah, yeah.
And so, the ones that are left either don't know they needed to get it, or don't want to get it.
Yeah, cause we did our employee clinic a while ago, so I think that folks are definitely. It's dwindling in numbers for those that would still be looking for it.
Yeah, when I asked at CVS, because of course I chatted with the person giving me the vaccine. He said, how's it going? Are you getting a lot of people? Oh, yeah, but it kind of comes and goes. I said, just for COVID? Oh, no, a lot of flu.
Did they do flu and COVID the same day with you?
They are willing to, but I opted not to.
Yeah, that's interesting, yeah. Cause folks I know who are older, when they went, they were advised not to get both at the same time. To wait.
I know, I had a friend who got them both at the same time and wound up in the hospital.
Ugh,
Well, it puts a lot of stress on your immune system. It's got to.
yeah,
And if you're older, you get the high titer flu vaccine, which is even more big time.
so that's probably why.
So they probably got a, massive, immune response.
So do you space it 2 weeks, or what's like the?
I've been telling people 2 weeks.
When you fill out the form at CVS, they ask you if you had a vaccine in the past 4 weeks,
Oh, okay, okay.
to which I said, yeah, here. Oh, well, that's okay, because you could have gotten both at the same time. So, anything else, that you're okay with?
So we're saying the 6th, right?
Yeah, the first Wednesday, certainly November and maybe December,
Okay,
because Dana needs to notify all of the septic people, right?
Yep.
Because everything got confused when we started switching around, and we were the second and fourth, now we're the first and the third, we used to do twice a month, now we do once a month, So, any questions you have for any of us? We can clarify probably anything that you would like to ask.
I don't think so. Just trying to follow.
I hope we didn't lose you in the process.
No.
Not at all.
When I first joined the Board of Health, I didn't know the first thing about septic systems, because I'd never lived it anywhere where there was one.
I'm sure you found that fascinating.
We get a lot of those.
Like that birds. Too. Like icebergs.
Fogbergs,
Yeah.
fog, fat soils in Greece, fogbergs. Then there have been fogbergs in other parts of the United States, and they have been horrific.
Yeah, that's why I was joking with the people
Yeah.
from,
Because I always tell people
Shall we
like,
see
when they hesitate about putting in a grease trap or taking care of their septic systems, I always remind them that whatever went out that got stuck is going to come back. So do you want that in your restaurant? Do you want that in your house? It's gonna come into your washing machine, in your shower. Yeah,
And in England, they had to dig up the pipes because they put little video cameras through the pipes. And they found complete blockages on the sewer system.
yeah.
And so they had no choice. They had to dig up the pipes and replace them.
So that's really why, and you did mention that, Dr. Poppin, which was good, that we are we're not recommending, we're requiring all of our food establishments on town sewer to have either an automatic grease trap internally or a 2,000 gallon grease trap externally. Because of that, because of fats, oils and grease getting into the town sewer and what really could happen if that. It could be horrific,
Yeah.
absolutely
The
horrific.
last thing we need is to have closing down the sewer system in parts of the town so they can dig it up and replace it to get rid of the fat bird.
Yeah, not good. Not good at all.
Anyway, at this point, I guess unless anybody have anything else for new and old business? We cover the shops, I'm a little concerned.
November 1st, I'll be here with my boxes. That I have in my car. If I ever get stopped by the police, they're gonna wonder why I have
What do you have?
Sharps boxes.
Oh.
My filled Sharps boxes.
I will let you know when it arrives. That's why they'd like, if they were so funny, they're like, well, we kind of recommend that we only, when you start out, we only come like maybe like, every other week. I'm like, oh no, you don't understand. We have residents waiting
Yeah.
to come in, so.
In my car.
And I was shocked that the CVS that actually sells these things will not take
No.
them back.
No,
Veterinarians are supposed to take them back if they're prescribed for your animals, but they.
that's what they are.
Yeah.
They're for my dog.
Yeah, they don't take them
I
back.
took them back to the vet and they
Yes.
took them.
Oh, they did take them?
They
That
didn't,
was nice.
they didn't like doing it,
Yeah,
but I said, well, somebody's gotta take them.
they're supposed to, but
You
no.
gave them to us. Here they
But-
come.
They
We
take
only have-
expired needles too. If anyone has expired needles. Veterinarian offices take them.
Oh.
So if there's no further business, I just need a motion to adjourn.
So move.
Motion made by Dr. Reed. Is there a second?
I'll second.
Had to be made. I just call the roll, we lost one, but Dr. Reed, yes or no?
Yeah,
Meg, yes or no?
Yes.
Myself, yes.
very good.
Meeting is adjourned.
Have a good night.
Bye.
Night.
Are you going back to the office? Okay.